Here we'll talk about malignant melanoma. So melanoma means it arises from the melanocytes, and malignant means it's a malignant condition. So it can be found on skin, oral, anogenital, esophageal, conjunctival, orbits regions, right? But in case of males, it is most commonly seen in trunks, and in case of women, it is seen on legs. Coming to the risk factors, white people on exposure to sun because they have less melanin content, and UV rays exposure, age, family history, these all plays a role in this malignant melanoma. And apart from this, gene mutations like GF amplification, CDK4 amplification, P16G tumor suppression, and also proto-oncogene INT2. So what are the gene mutations happening? GF amplification, CDK4 amplification, and P16 gene is getting suppressed, and INT2 proto-oncogene. Right, so these are the different risk factors. Coming to the clinical features, there might be a flat or slightly elevated nevus. Nevus is mole, right? So there will be de novo nevus. What do you mean by de novo? It will be newly appeared nevus. It is not present from the birth. It will be somewhere appearing after some time in the life, right? So this malignancy will be appearing de novo or newly appeared, and it will be having irregular borders, variegated pigmentation. In some places the pigmentation is more, in some places the pigmentation is less. And also you can notice the secondary changes like ulceration, bleeding, increase in the size of this nevus and all, right? So for this you have ABCDE criteria for malignancy. To tell if it is a malignant condition or the benign condition, we use ABCDE criteria. So the A stands for asymmetry. If it is asymmetrical, it is malignant, most likely malignant. And B stands for border. If the border is irregular, again it is most likely malignant. If the color changes, if the diameter is more, that is above 6 mm, and if it is having this raised elevation, all this increases the risk of malignant condition. Now coming to the types of malignant melanoma, you can remember it by the mnemonic ILAND. In ILAND, S stands for superficially spreading melanoma, L stands for lentigo maligna melanoma, A stands for acral lentiginous, N stands for nodular, D stands for desmoplastic melanoma. Right, now let's just talk about this first thing, which is lentigo maligna. So there is some pre-existing lentigo which is getting converted into this malignant condition, and usually just removal of this lentigo will take away the problem. So you will be having this good prognosis, and also you cannot see any secondary changes like bleeding, ulceration. You cannot find any secondary changes in case of lentigo maligna. But in all other types you will be finding ulceration and also secondary changes. So the prognosis will be poor compared to this lentigo maligna. So we are done with lentigo maligna. Now coming to superficial spreading. This slightly elevated surface, ulceration can be present, variegated color can be seen. Not so good prognosis, right? Because ulceration is present, secondary changes are happening, so not so good prognosis. Coming to the acral lentiginous, again there is ulceration, there is metastasis. So this acral lentiginous is often found on soles and palms, on the thick surfaces like soles and palms, oral, and the mucosal surface. So there will be metastasis also. Again it is poor prognosis. Coming to the fourth one, which is nodular. So by the name itself you can write this clinical features, right? It will be elevated, it will be nodular, deeply pigmented nevus, rapidly growing, ulceration is present, poor prognosis. So in case of desmoplastic, there can be reoccurrence. That means if you remove once, there can be a chance of getting again, and ulceration and secondary changes are seen. Here you can see neural invasion, and also fibrotic stroma can be seen. So if we summarize all the points, in S there is ulceration, in everything there is ulceration except for lentigo maligna. This lentigo maligna has good prognosis, and every other type will be having somewhat poor prognosis. Now coming to the D, which is desmoplastic, you can see ulceration and also neural invasion, fibrotic stroma, right? So this neural invasion is seen in desmoplastic. So this is the types of malignant melanoma. That's it. Bye.